Hello friends, my name is Dr. Gaurang Krishna. I am a hair transplant surgeon at MedLinks New Delhi. Welcome back to our channel, and today we'll be discussing a very important topic, and it is one of the frequently asked questions. Which technique to choose, FUT or FUE? Today we'll be having a look on this topic totally in a non-biased view. See, in my clinic, most of the surgeries are the perfect eye surgeries, which is a modification of FUE. But in 10 to 15% patients, we do use a combination. So we do a lot of FUT procedures as well. And thus, working on these two techniques in the last 10 years, this is what I have concluded that I'll be sharing with you in this video in a very unbiased way. So let's start the video. We'll be covering the differences between FUE and FUT under these headings: number of grafts, scarring, because that's a very common concern, longevity of hair, possibility of doing mega sessions, the discomfort, and finally which gives us a better result. Now coming on to the number of grafts, that we'll understand through this little drawing. Now have a look in this picture. So this is the donor area, a typical India donor area, which has a density of 70 to 80 grafts per square centimeter. So if we are to do a FUT procedure, this will be the strip line, which is roughly 1.25 to 1.5 centimeter broad and approximately 20 centimeter long. Now this is what we see in most of our patients, but it varies. The length, the breadth, it varies depending on how big your head is, depending on how elastic and movable your skin is. But let's, for argument's sake, let's say an average patient, 20 centimeter long strip and 1.5 centimeter broad. So that gives us a tissue of 30 centimeter square. Assuming a density of 80, we'll get around 2400 grafts, and if we have a density of 100, we'll get roughly 3000 grafts. So that's the number, 2400 to 3000. That is what we get in a typical Indian patient with the FUT procedure. Now, what we do in FUE? So the main difference between FUE and FUT here is that instead of 1.5 centimeter, the working area becomes around 5 centimeter, because we are working in the entire donor and not a restricted breadth. So here the working length is the same, that's 20 centimeter, and working area is 4 to 5 centimeter. Let's say 5 centimeter. So we have, instead of 30, we have 100 centimeter square working area. But in FUT, we get 100% hair from the tissue, whereas in FUE, we get roughly 30 to 40% of hair, because we can't take every single hair. We have to give gaps. Basically, for every hair that is taken out, 2 hair are left there so that the area remains covered. So out of 100 centimeter square, let's say our working area is 35%. So in a person who has a density of 80, we have 8000 grafts, and 35% of it becomes roughly 3000 grafts. And when we have a density of around 100, we have 10,000 grafts, and 35% of it is 3500. So in a typical FUE extraction, in most of our patients, we get 3000 to 3500 grafts easily. So we see the number that can be extracted either through FUT alone or through FUE alone is the same. It varies between 2500 to 3500. FUT does not score over FUE or vice versa when it comes to number of grafts. However, when we combine the two techniques, then we get 1000 to 1200 more grafts. Second most common concern here with FUT particularly is that it gives us a lot of scarring, and FUE has been promoted as a scarless procedure. First of all, FUE is not a scarless procedure. It gives many micro scars, whereas FUT gives one linear scar. Now, an FUT hater, a person who wants you to deviate away from FUT. So now, if we are against FUT, if I want you to move away from FUT, I'll show you this picture that FUT gives a very bad scar. You should not choose it. However, an FUT defendant, if I want you to do FUT, I'll show you this picture that FUT gives an excellent scar. Now you understand, here is not the technique which gives a good or bad scar, it's the execution, the post-operative care that really defines the scar. So if I do not do my surgery properly, if the patient does not care nicely after the procedure, we will land up with a bad scar. However, if my surgery goes well, if I do my measurements correctly, if I do my closure correctly, and the patient takes proper care in the next 2 weeks, we are going to get a good scar. So FUT, if done properly, trichophytic, proper thickness, a good closure, will give us a very nice scar which will not be visible even if your hair is shorter. And if the procedure is not done properly, that even if the hair even if we wear the hair longer, the scar would be visible. So scarring is not a major criteria when you decide FUT versus FUE. When I want to push you away from FUE, I will show you this picture that FUE leaves a very bad scar. But when I want you to pull towards FUE, I will show you this picture which tells you that FUE gives a very good scar, hardly visible. Again, it's the execution and the post-operative care. If the instruments used were rough, big, then it leads to a bad scarring. If the instruments used were fine, properly executed, narrow, less than 0.9 millimeter, then what we get is a very favorable scarring. So first of all, FUE is not a scarless procedure, but micro scars which are hardly visible. If the procedure is not done properly using bad instruments, then we get bad scarring. Most important thing, the results. FUE and FUT gives you similar results. Same example. I want to push you away from FUE. I'll show you this picture. If the person got an FUE procedure done, if the surgery was a complete failure, so FUE is a bad surgery. But when I want to pull you towards FUE, I will show you this picture. FUE procedure done and the person has got an excellent result. Interesting thing is, both are the same patients. Same patient, same technique, FUE, bad result, good result. So it comes down to the execution. The procedure was not good or bad. Procedure was the procedure. The techniques remains the same, but it's the execution that was different, and that's why a different outcome. Same goes with FUT. Bad result, FUT. Excellent result, FUT. So the procedure is not good or bad. It's the execution and the post-operative care that is good or bad, and which results in an improper outcome. Of course, donor characteristics, they vary. Same team, same technique, but two different patients will get two different results. A person having a good donor area will get a better result as compared to a person who has a weak donor area will get an inferior result in either of the techniques. Mega sessions are possible either when you combine FUT and FUE or FUE alone. Why FUE alone? Because we can take hair from the beard and the body. So in this gentleman, grade 5 male pattern hair loss, the entire area was covered in a single session of around 6,000 grafts where hair were taken from the back of the scalp, the beard and the chest. That is why we were able to give a good coverage on the front and a medium coverage on the vertex or the crown area because we use the beard hair. With FUT alone, this would not have been possible because for these areas, FUT procedure it's impossible to wear FUT on the beard. So FUE alone can give us a mega session, but FUT alone cannot do that. However, the ideal way, particularly when we do not have beard hair or we don't have a lot of beard hair, is a combination of FUE and FUT, where each technique will give us roughly 2400 to 2500 grafts. So 5000 grafts just from the scalp in a single go is possible when we combine the two techniques, which also gives us an excellent result. Now coming on to advantages of FUE. Why I'm saying advantages of FUE? Because in the last 7 to 8 years, this industry has seen a paradigm shift. Last decade, when most of the surgeries that were done were FUT, in this decade, most of the surgeries, most of the hair transplants that are being done are FUE. And there are certain valid reasons for it. First of all, FUE is a much more comfortable procedure because it is less invasive. Clearly, if you have seen videos of FUT and FUE, you would agree that FUT is a more invasive procedure, FUE is less invasive. So less pain, less swelling, faster recovery time, and no chance of like what we call a tender scar. In FUT, sometimes patients get a tender scar which may hurt them for 4 to 6 months. That does not happen in FUE. So it's a more comfortable procedure. In my opinion, this is the difference. Instant transfer. What we call the perfect eye technique here at MedLinks is that we take out the grafts through the FUE method and immediately implant it back on the scalp. This has a lot of benefit because graft survival is much more when you're not storing the grafts. This is simply not possible in FUT because, as you know, once the strip chunk is taken out, it is processed on a table and it takes a lot of time. So from the time when the strip is harvested to the time when the last graft goes back into your scalp, it is easily 4 to 7 hours. That's where it makes all the difference, is that in FUE, instant transfer is possible, which is not possible in FUT. So in my opinion, that is the factor that has pushed me away from FUT. And now why most of our surgeries are the perfect eye technique or the modified FUE technique is because of the instant transfer. If grafts are stored after FUE, in the normal FUE, when the grafts are stored, the results will be similar to FUT. Beard and body extraction possible through FUE and not FUT. The scar of FUE sometimes would be a lesser visible scar because it is scattered throughout the donor area. And cherry picking. Cherry picking is possible only in FUE. Let me explain cherry picking to you. Now this is our view. When we are doing the perfect eye technique, this is our view. So when we are doing an FUE perfect eye procedure, I can cherry pick the best grafts. But I will easily leave the bad grafts because I can choose during the procedure, during extraction, which to take and which not to take. In FUT, that luxury is not there. If I have taken this strip, I have to use this graft, this graft, this graft, this graft and this graft. No matter it is a single hair graft, double, triple, thin, better, we have to use all the grafts because the strip, the chunk has been taken out. So that is again a major difference, major advantage of FUE is that cherry picking is possible. Coming on to the conclusion. Well, in my opinion, you should leave the decision to your surgeon. Choose the surgeon, not the technique primarily. If you feel comfortable enough with a particular doctor, you have seen great results with that doctor, and if he tells you that do FUE, this is why. And if he says do FUE, there will be a reason behind it. If he says do FUT, there will be a reason behind it because he'll be checking your scalp, your laxity, the condition of the donor area, and his expertise. So, go by the surgeon and not by the technique. But let's say we still have to answer this question, FUE or FUT. I am personally slightly inclined toward FUE, particularly the modified FUE perfect eye technique because of the reasons, because of the advantages we just discussed. Comfort level is there, results are excellent because there is no storage, cherry picking is possible, and we have the luxury of doing mega or giga sessions, 4,000, 5,000, 6,000 grafts depending on the availability of the body donor. In a patient where we have to do a giga session and body donor is not available, we do a combination of FUT and FUE, which has been working excellent for us. Also, in certain young individuals who do not want to take medicines, either we do FUT as the first surgery or we leave an area for the FUT procedure to be done in the future if, God forbid, there is a need of it. So, the take home message here is that if you have to choose one technique over it, if you have answered that question, then maybe FUE, modified FUE particularly. But there is not a huge difference when we compare these two techniques individually. So I hope I was making sense during this video, and if you have any questions, please feel free to ask us in the comment section or give us a call. Thank you so much.